Since the field of medicine was established, researchers and clinicians have worked tirelessly to find the treatments that keep us healthy and alive. The evolution of their efforts is extraordinary, and today we're at a point where we can harness the power of our own stem cells to help treat some of the most common medical conditions. Stem cell therapy is being called the future of medicine, and for those who work in this niche discipline, the future is now.
The effectiveness of regenerative medicine within the past greater than a decade have actually demonstrated that stem cells from our own bodies have properties to regenerate tissue, to form new vasculature, and to help control our immune system, or what's called immunomodulation. These cells can actually form new vasculature, which actually, in cases of stroke or cardiovascular disease, can form new blood flow to the vital organs that are necessary to help heal the tissue.
Because of their regenerative properties, adult stem cells have been used to safely and effectively treat certain diseases and injuries like COPD, arthritis, diabetes, sports, and spinal cord injuries. At this lab in Costa Mesa, California, scientists work to improve upon the strides already made.
Using stem cells for the treatment of diabetes or arthritis, for instance, it's the properties of the cells that can actually change in arthritis, change into chondrocytes, or change into, which is cartilage tissue, or change into bone. And it can help patients directly by not only that, changing and regenerating tissue, but also lowering and controlling the inflammatory system that occurs within the joint. When we discuss diabetes, we think of not necessarily insulin-producing cells, because we're not at that point yet with adult stem cells. What we can do is control symptoms, which is what actually are the problem of the disease. Like secondary symptoms of the disease, when a patient gets a laceration of the leg, the wound doesn't heal correctly, we can do local injections and actually cause the wound to heal completely. Stem cells can be acquired from various locations, and not everyone can be actually a candidate for stem cell therapy. We can actually acquire stem cells easily through a bone marrow aspirate or through a fat extraction, obtaining it from umbilical cord tissue now, and from umbilical cord blood, which everybody's very aware of when they collect umbilical cord blood for their children. So these tissues that are obtained can then be harvested or purified into a specific type of stem cell and used for later uses.
Cellular therapy has proven to be limitless in its potential. What lies on the horizon can change the way we treat just about everything, greatly improving our quality of life.
Here at Da Vinci Biosciences, we actually started greater than 9 years ago doing studies in spinal cord injury, and our focus was actually to try to help spinal cord injury patients by using stem cells with this. And what we did note was in a publication is that we noted that patients improved their quality of life. That's one of the things that you will see regularly with patients after being treated with stem cells. It's a change in the quality of life. Significant changes as to a patient being able to walk a mile versus they can only walk a block previously. These type of changes occur in cardiovascular patients regularly. Da Vinci Biosciences, we continue to focus on using various different types of stem cells to actually help patients with specific different types of disease. We're focusing more on osteoarthritis, rheumatoid arthritis, arthritic models more than anything right now, and cardiovascular disease, because cardiovascular disease is the #1 killer in the nation.
If you or someone you know suffers from one of these conditions, Rehealth may be able to help. As a leader in regenerative medicine, Rehealth uses stem cell therapy to help treat some of the most common medical conditions in their state-of-the-art treatment facilities.
Da Vinci Biosciences works in collaboration with Rehealth, a center that's actually ex-US for therapies of stem cells or for clinical studies of stem cells. When you decide to use Rehealth, it's an overall package that you actually obtain a scientific backing of all the studies that we've actually done here within the United States at Da Vinci Biosciences, and Rehealth also, which is our collaborative partner, that's actually approved to do these therapies ex-US.
Rehealth's friendly staff will guide you through the process every step of the way, because their goal is to give you the highest quality care in your quest to feel your best.
So the first thing we need to do when a patient wants to know if they're a candidate for stem cell therapy is find out why they need stem cell therapy. What's the reasons, what are the diseases that they may have, and is stem cell therapy appropriate for those diseases? Once we have that information, we share it with our scientists and our physicians to make a determination if it's something that we could actually help the patient with.
While the medical experts at Rehealth continue to use proven applications, there are exciting new developments that lie on the horizon.
As a company, we're working on several different things for the future, and one of them is trying to make stem cell therapy affordable for everybody. And the way that we think we'll be able to do that is by using umbilical stem cells as an off-the-shelf type product to be able to treat patients with different disease states. We feel these stem cells are young, healthy, and vibrant and are able to give the patients the extra boost that they'll need for a long, healthier life.
To learn more about Rehealth's cellular therapies and how we might help you, visit us online or call the number on your screen.